So these are going to be our treatment rooms. So when a client first comes to the clinic, they see a nurse and they have a triage. So we ask them why they were here and find out what they are needing today and then have them register. So we have a conversation with every client when they first come in. So that will happen in these front rooms. So either this room over here or this room here or this room here. Okay, these will be, so this is called our triage room over there. That's where the triage nurse will work out of. And this will be where the treatment nurses work out of. So this will be a treatment room. This is also one of our larger exam rooms. It's also going to have an accessible motorized bed for any clients coming in a wheelchair, so that they would be able to get onto the exam bed.
And that's a new service that we're offering.
Having the specialized bed. Okay. So as you come, a client would then, they might be just seen in the treatment room and discharged from them, depending on what they're coming for. Usually if they're coming back for a revisit or follow-up or just for treatment, they might just be seen in the treatment room and that's all. Okay, but otherwise, if a client's coming in and they're new to us and they're wanting testing, then we would be bringing them around to our interview rooms. This is going to be the accessible toilet. This is one of our washrooms, sorry, and this one is large enough and will be accessible. This is an interview room. It will be used for interviews as well as treatment. So this is actually where our flex, what we call our flex nurse, will be working out of. And she will be seeing anybody that needs treatment or an interview, just depending on how many clients we have, what their needs are. So she's, you know, dealing, we're calling it the flex role because she's dealing with anything that needs to be dealt with that day, okay, with the client needs. This is another interview room that we're using as an interview room right now, so the client would be seen and be interviewed and counseled by a nurse. So given all their questions answered and any counseling done, as well as their blood taken if they're wanting testing for HIV or syphilis.
Okay, so there's 3 initial intake rooms now, did you say? I'm just trying to, like the triage rooms, I think you
Yeah, the
called them?
triage rooms, so at the very beginning, at 12:30 when we open the doors, we have 3 nurses who are doing triage. We can often have, say, up to 30 clients waiting at that time. So we have 3 nurses quickly speaking to the clients, seeing why they were here, having them register, and then we determine what nurse needs to see which client. So they could be seen by a treatment nurse, they could be seen by an interview nurse, they could be going directly to be seen by the physician, they could be seen by a nurse practitioner. So it's with the triage process that we decide who will see this client and how long we think the visit will take. Okay? And then by determining that as well, if because there's 30 clients, there could be a wait for, you know, some clients, we might be able to say, well, we hope to say when their appointment will happen, when their visit will happen, that they'll be able to leave the clinic and come back. So we always ask them to come back 30 minutes before that appointment time because we're ahead of schedule, which is always a goal. Okay.
You guys want to walk in?